How are you?
Good, thank you.
Okay, my name is Jeannie. I'm a family nurse practitioner student at LIU, and I'm here to perform your physical assessment. Is that okay with you?
That is okay.
Very good. I'm going to first wash my hands. Can you tell me your name?
My name is Daisy.
Okay, what is your date of birth?
May 21st, 1992.
Can you tell me the month and the year?
This we're in August 2021.
Okay, who is the President of the United States?
Joe Biden.
Okay, very good. I'm going to tell you 3 words that I want you to remember because I'm going to ask you at some point of the exam.
Okay.
That is table, chair, and spoon.
Okay.
Okay? Now, are you able to count backward from 10 to 1?
Yes, I am.
Okay, can you do that for me?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Now, I'm going to take your blood pressure. I'm going to ask you to extend your hand to me. Okay. That's it.
Thank you.
160. Good. 110/7. Thank you. I'm going to check your pulse and respiration. Okay, very good. Your pulse is 68 and your respiration is 80. All right. Okay. First, I'm going to examine your skin. I'm going to examine for any lesion, any mark, any scar, and there is none. I'm going to palpate to see if you have any lesion, any mass. No lesion, no mass. And I'm going to examine your scalp, but because patient has a wig, it's hard to see the whole scalp, but the front look evenly distributed, no sign of lines or hair distribution is normal, coarse and black, okay? I'm going to palpate your head. Let me know if you feel any tenderness, okay?
No tenderness.
No tenderness, everything is good?
Mm-hmm.
Very good. And then the head is midline to the body, and then eyebrows are coarse, evenly distributed, and then lashes are curled up. So everything, head is normal, cephalic is written normally. Okay, now what I'm going to do next, I'm going to be checking your eyes, okay?
Okay.
I'm going to check consensual reflex to light. I'm going to use the light, and I'm going to go from the side, and I'm going to observe the other pupil. I'm going to do the same here also, and direct light vision. I just want you to look where is reactive to light, and also where reflex is present. Okay, so now what I will also ask you to do, I'm going to ask you to look at my finger, okay? And then after that, you're going to look at my finger, and then look for Look over there. Look at my finger again. And look over there. Okay. And now what I want you to do, I'm going to do a series of movement with my hand, and I want you to look at my finger and follow my finger without turning your head, okay? I'm going to do the cardinal sign, okay? Just look at my finger. Even with this sign, I was able to access cranial nerve number 3, 4, and 6. They are intact because patient was able to follow comment. And now I'm going to check for cranial nerve number 2, which is optic nerve. I want you to tell me when you see my finger, okay?
No. No. No.
And I'm going to use the standing chart. I'm going to ask you to read a line. What I will ask you to do is to cover your white eyes first. Okay, thank you. And I'm going to ask you to read this line for me.
LTFPH.
Okay, what color is that?
Red.
What color is that?
Green.
Okay, I want you to cover the next one and read the line for me again.
LTFPH.
What color is that?
Green.
What color is that?
Red.
And I was able to access optic nerve number 2 and is intact. Now, what I will ask you to do next I'm going to ask you to cover one nostril and then breathe. The other one do the same. Breathe. Okay. I want you to close your eyes and you're going to tell me what you smell. What do you smell?
Coffee.
Okay, I was able to access cranial nerve number 1, which is olfactory and is also intact. Okay, so now I will palpate your sinus, but before I do that, I'm also going to look at your palpate around your eyes, and your lacrimals are within normal limit. There is no oozing, no leaking when I palpate. Also, let me know if you feel any tenderness when I'm doing the palpation, okay? Do you feel frontal sinus? Do you feel any tenderness?
No tenderness.
Any tenderness here?
No tenderness.
Okay. And then I'm going to go on and palpate your lymph node, okay?
Okay.
I'm going to palpate your pre-auricular, your post-auricular, your occipital, your tonsillar, submandibular, submental, anterior cervical, posterior cervical, and this is the notch, and your trachea is midline, and I will also assess the thyroid, and I'm going to go to the back. I'm going to ask you to swallow. Hold this for a minute. So I can assess your thyroid. I'm going to ask you to swallow for me. Okay, very good. There was no sign of enlargement of the thyroid. Thank you. And did you feel any tenderness? Anything?
No.
You feel no tenderness. Wonderful. Okay, so while I'm at it, I'm gonna test for the cranial nerve number 5, which is the facial with trigeminal cranial nerve number 5. What I'm gonna ask you to do is to open your mouth while I'm palpating the TMJ. There is no clicking, and go left and right. Cranial nerve number 5 also have 2-part motor and sensory. I'm gonna ask you to close your eyes and tell me what you feel. What do you feel now?
Soft.
What do you feel?
Soft.
What do you feel?
Dull.
What do you feel?
Dull.
What do you feel?
Sharp.
What do you feel?
Sharp.
Okay, so cranial nerve number 5, trigeminal, is intact. You can open your eyes. Now, what I will ask you to do also, I'm going to ask you to smile for me, and I'm going to ask you to frown. Don't let me raise your eyebrow. Okay, all right. And cranial nerve number 7, which is facial, is also both motor and sensory. The sensory part we're going to omit. but it will be where you ask the patient to take salt or sugar. Okay, so now I'm gonna go on. Okay, I'm gonna do a few more tests. I'm gonna go toward the back. I'm going to access cranial nerve number 8, which is acoustic. In doing so, I'm just going to whisper something at 2 feet in the patient's ears, and then I'm gonna ask her to repeat it.
99. 1, 2, 3.
Cranial nerve number 8, acoustic, is also intact. Patient was able to repeat the word that I whispered to her. And I'm going to check the tympanic membrane of the ear. Before I do that, I will palpate the auricles and ask patient if she feel any tenderness,
No
any
tenderness.
pain.
Okay.
No tenderness, no pain. Now what I will do, I will just look inside your ear. I'm gonna pull up and back, and then I'm going to observe. Tympanic membrane is pearly gray, and the cone of light is at 5. Okay, let me take the other one. I'll do the same here. I hope you can see me. Let me just turn you for a minute. Up and back. And I'm going to find the right position. Tympanic membrane is pearly gray, and cone of light is at 7. Very good, thank you. Okay, now I'm going to perform what we call the Weber test, where I'm going to ask the patient to tell me if you feel the vibration the same bilaterally, okay?
Oh.
Okay. Do you see the
I
difference?
feel the vibration, but I don't really in both ears.
Okay.
I hear it in both ears, so.
Very good. Now I'm going to perform the Rennie test. And the Rennie test, I'm going to tap it and put it under my thought process. And I'm going to tell the patient to tell me when it's diminished, and to check for bone conduction and air conduction. Okay. My thought process. Tell me when it's diminished.
No. No.
Air conduction is greater than bone conduction, and that is very good. So we're going to do the other side. Let me turn you for a second. My thought process. Tell me when it diminished.
No. No.
Okay, very good. So now, next, I'm going to ask you to, I should have checked inside the nose before, but I can do it now. I'm going to ask you to lift the tip of your nose, and I'm going to use the light. Okay. There is no charge of discharge, no sign of discharge or bleeding in the nose. No sign of discharge or bleeding. It's pink and moist. And the septum is midline. Very good. Thank you so much. Okay. Now I'm going to do a little bit of the worst part where I'm examining your. Sorry, I'm just getting into it. Okay. I'm going to ask you to open your mouth, and there are no lesion or cracks on the patient lips. I'm going to ask you to stick your tongue out. Take it to the left, take it to the right. I want you to lift it up, down. Okay. All right. Okay, just open your mouth, please. Okay. All right. There are no signs of gum disease. Mouth is pink and moist, and then I'm gonna ask you to say ah.
Ah.
Open your mouth and say ah.
Ah.
The tonsil, no exudate on the tonsil. and the 2 plus, the UV line is midline, and dentition is appropriate for patient age, and you can open your mouth, open your eyes. I'm just gonna stick my hand inside, and I could feel the hot palate in the front and the soft palate in the back, and the bottom also is it's very good. Okay, I'm just gonna wash my hands a little bit. Okay, all right, I'm also going to observe the patient neck for any vein distension. There are no vein distension and no swelling, and very smooth. And I'm going to check, in examining the mouth, I check cranial nerve 9, 10, which is the vagus nerve, and also cranial nerve 12. Now I'm going to check cranial nerve 11, which is the spinal nerve. I'm just going to shrug and prevent me from turning. Very good. So cranial nerve 11 is intact. Okay, that's very good. We're going to go on. We're going to examine the anterior chest. Okay, and I'm going to inspect and also palpate, which I think I already did. And I'm going to percuss. I'm supposed to hear resonant sound, and it is resonant. In observing the patient chest, she's not using any accessory muscle to breathe, so that is a good sign. And I'm just going to ask you to relax yourself and take nice deep breath while I use the diaphragm of the stethoscope to listen to your breath sounds, okay? Just relax and breathe, okay? Okay, there are no adventitious breath sound, and I'm just going to go to the back. You can close up a little bit. Okay, I'm just trying to expose the back. I think the camera can see me. I'm going to turn your head and expose your back a little bit. Okay, here. I'm going to check for any sign of mass, lesion, scar, and there is none. Patient back is really clear. And now I will palpate, and I'm going to ask the patient to say 99.
99.
Okay, repeat 99 for me again.
99.
Okay, I was able to do the tactile phonitis where the patient say 99 and I could feel the vibration. And I'm going to do the egophony, where I'm going to ask the patient to repeat the letter E, and I'm supposed to hear A. Can you repeat E for me?
E.
Mm-hmm.
E.
Mm-hmm.
E.
Mm-hmm.
E.
Mm-hmm.
E.
Mm-hmm.
E.
Okay, very good. Now I will ask the patient, I'm going to do ask the patient to whisper 99 for me. Can you whisper 99 for me? I was able to perform the whisper pilotory, and it's also good. So now while I'm in the back, I'm also going to listen the breath sounds of the patient, and I'm going to ask you to breathe, relax and breathe. Take a nice deep breath. Good. Okay. And I'm going to check the chest expansion. By putting both of my hands, I'm gonna ask the patient to take a nice deep breath, and I'm going to observe how my thumb go. Very good. And also I'm going to use the centimeter to check the epidiameter, which is supposed to be 2 to 1. So in doing it, I'm going to use the centimeter, and I'm going to measure the patient back, which is about 16, and I will also measure the side, which is also about 8. So that's very good. And I'm going to check for severe tenderness. I'm going to tap the back of the patient and ask her if she's feeling any tenderness. Do you feel any tenderness?
No.
Any tenderness?
No.
Okay, very good. You can cover. I'm going to turn you again. Are you okay?
Yes.
All right, very good. All right, thank you. So now, while patient is sitting, I'm going to listen to the heart sounds, both with the bell and the diaphragm of the stethoscope. So, I'm going to expose the patient's chest. For the clavicular, I'm going to check 1, and the second intercostal to the right. I'm going to listen to the aortic artery. To the left, second intercostal pulmonic. To the third intercostal, I'm going to listen to the up point, to the left. And I'm going to listen to the tricuspid on the fourth intercostal. And the apical or mitral to the fifth intercostal, mid-clavicular. I'm going to ask her to lean forward a little bit. S1 is heard the loudest on at the apex and at the apex of the heart, and S2 at the top, the base of the heart. So I'm going to listen with the bell now. Same process, same 4 points. Aortic, pulmonic, up point, tricuspid, mitral, just lean forward. Okay, that's very good. So S1 and S2 were heard, and there is no heart murmur, no extra sounds. Okay, thank you. I'm gonna ask you to lay down for me now, please. Thanks a lot. Okay. While my patient is laying down, I'm going to palpate all the pulses. I'm going to palpate and I'm going to listen. Okay, bilaterally, temporal pulses. And the carotid, I'm going to palpate one at a time. I'm going to ask my patient to turn her head to the left. If she had any sign of jugular vein distension, that's where I will see it. And the way I will measure it, I will use a ruler to put on the side for the process, and then I will use any kind of straight cardboard to measure. In this case, my patient is about 3 centimeters, which is within normal range, and because she got no jugular vein distension. Okay, and then now I'm going to check for the brachial pulse bilaterally. Thank you. Are you able to see? Radial. Sorry, I'm going to feel for the femoral pulses. popliteal behind the knee. Bilaterally. Dorsalis pedis. Bilaterally. Posterior tibial. Now I'm going to listen for any buoy to the calcid and temporal with the bell of the stethoscope. Buoy. Buoy. And while my patient is on the supine position, I'm also going to listen to the heart sounds one more time with the bell of the stethoscope. Aortic. Right second intercostal. Pulmonic. Left second intercostal. Point. Tricuspid. I won't do that. I want you to do it. And that's fifth intercostal with clavicular. Very good. You can lay back down. Thank you. Now I'm going to cover my patient. Privacy. Okay, I'm going to observe the abdomen for any scar, any lesion, and any mass, and there is none of that. And my next thing, I'm going to auscultate. I'm going to use the bell of the stethoscope to auscultate the aortic artery. It's midline toward the left. The two veno artery above the umbilicus. Bilaterally. Two iliac artery below the umbilicus bilaterally. And of course, I had already listened to the femoral bilaterally. Okay. Now I'm going to be listening for bowel sounds in all four quadrants. I didn't hear no bowel sound, but in normal circumstances, I would wait for 5 minutes so I could hear the sounds. But in this case, we're just going to omit. And now I'm going to do percussion. In doing percussion, I will also check for the liver span. And the way to check for the liver span, I'm going to go from the clavicular and I'm going to percuss. I'm supposed to go from resonant to dullness, to some dullness. Right here I feel the dullness. And I'm going to go from the bottom, from tympanic to also some dullness. Tympanic, tympanic, tympanic. Some dullness here. And I'm going to measure And I'm going to use in centimeter to take the measurement of the 2 points that I mark. And it's about 7, which is normal for women, and it's 10.5 for men. Okay. And in the area also, I can try to percuss on the right, on the left upper quadrant for the spleen, where I could hear some dullness. Okay, and then now I'm going to percuss all 4 quadrants of the abdomen, and I'm supposed to hear tympani, which I can hear very well. And I'm going to do light palpation. In doing my palpation, I can also try to palpate the aorta, which is in the middle. And I'm going to do light palpation. I'm going to ask my patient if she feels any tenderness or pain. No pain, no tenderness. Very nice. No pain, no tenderness. Okay, I'm going to do it a little bit harder. Any pain or tenderness?
No.
Okay. All right. Very good. No pain, no tenderness. Okay. We're almost halfway now. Okay. I'm going to take off the sheet, and I'm going to do passive range of motion. I'm doing my musculoskeletal. Of course, I'm going to inspect, and I'm going to check for any edema. In this case, there is no sign of edema on my patient, and skin is warm to touch. There is the hair is showing that the patient shaved, but it's just coming back, no abnormality. It's hard for me to check capillary refill because my patient had nail polish, but everything looked very good. So I'm going to start by doing the range of motion, and I'm going to leave the knee, put down. And while I'm doing the range of motion also, I can observe that the patient tone is normal, is not flaccid, is not flat to the floor. And then I can do the same for the range of motion. And then I'm gonna ask you to resist. I'm gonna ask you to resist, very good. Resist, and ask you to resist. And can you just put of your foot? I'm just going to check for hip range of motion, and before I do that, I'll palpate. Do you feel any pain or tenderness? No pain or tenderness? Okay. Can I just take? Thank you. Okay, so this is how I would perform the exam, and then now I'm going to ask her to sit up so I can continue the examination. And I hope you'll be able to see. I can give you some privacy now. Okay. I want you to put your hand like this for me. And I want you to resist when I push. I want you to resist. I want you to go like this. And I want you to flex, extend. And I want you to open your finger. Don't let me close them. Don't let me close them. So bilaterally, the patient has the same force in both. And then now I'm going to ask her to close her eyes, and I'm going to check for all the sensation. Okay? So I'm going to put this up. You can close your eyes, and you're going to tell me what you feel. Okay? Okay. What do you feel now?
Soft, 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 sharp, 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 dull, 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 dull.
Okay, you can keep your eyes closed and put your hand down. You're going to tell me if you feel the vibration, okay? Do you feel the vibration?
Yes, I feel the vibration. 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 I feel the vibration.
Okay. in doing the neuro exam, I'm gonna ask the patient to flip her hands on, yes, okay? And I'm gonna ask you to close your eyes, and I want you to touch my finger and touch your nose. Do it the other one, so that's great coordination. And I want you to go like this. Okay. And then the next time, I will want you to close your eyes again. This exam, you do a lot of closing the eyes, okay?
Okay.
And I'm going to actually perform a series of tests to see if the patient can distinguish certain things. Say it again. Okay, open on your hand. What do you feel?
Coin.
Okay. What about this one?
Key.
What about this?
Paper clip.
What about this?
Coin.
Okay, I'm going to do something in your hand and tell me what I draw in your hand.
A.
What about this one?
W.
Okay, very good. All right. Now, I'm going to check for deep tendon reflex. Okay, I'm going to check for the tricep. Just relax, okay? Okay, I'm going to check for the bicep. I'm going to check for the brachial. This one I got very good. I'm going to do the other arm, tricep. Very good. Bicep. Brachial. It's like 2 inches over where you would usually check for the pulse. You get better result, okay? And I'm gonna do for the knee. I hope I'm not beating you up too much.
No, you're good.
Okay. And then I'm gonna do for the Achilles. While I'm down there, I will also do the Babinski reflex, where I'm gonna use the tip and to just go under the patient, and very good. She doesn't have it, it's good. It's not good for adults to have, but it's good for children to have. Okay, so we almost at the end now. I'm gonna ask you to stand up a little bit. I want you to turn because I want to observe your spine. And I'm going to expose you a little bit. And I'm going to ask you to bend down. And I'm going to observe the spine. There's no curvature of the spine. So everything looks good. All right. And then you can turn around, cover a little bit. Okay. I'm going to do the Wombat test. Is to check for balance. I'm going to ask the patient to close your eyes. Put your hand to the side and put your feet together. And I'm going to observe for 15 seconds to see if the patient is have any balance. And there is no issue with balance. Very good. I'm going to ask you to do the heel to toe walk. Okay. I'm going to ask you to walk on your toe. I'm going to ask you to walk on your heel. Okay, now we'll work out. I'm going to ask you to put your hand up. Come over here so the camera can see you. Put your hand like this, like this, like this, and I want you to go range of motion. I want you to go like this behind your head and extend. I want you to go like this behind your back and extend. Okay, very good. I want you to lean on the left and I want you to lean on the back. And I want you to do a motion with your foot, and I want you to do with the other one. And you can have a seat now. And I think the last thing that I'm going to do is the ponytail drift, and that will be the end of our exam. Can you just extend your hand and close your eyes? Okay, I'm going to take 15 seconds to count. Okay, thank you so much for your time. Very good, and that will be the end of my assessment. Thank you so much for watching. Goodbye.